Do you ever wonder what causes those pesky cold sores or even genital herpes? Well, it's a virus known as herpes simplex virus, or HSV for short. This little critter isn't as simple as its name might suggest. There are two types of HSV, creatively named HSV1 and HSV2. HSV1 is the primary cause of oral herpes, resulting in cold sores or fever blisters around the mouth. On the other hand, HSV2 is mostly responsible for genital herpes. But here's the tricky part. Both HSV1 and HSV2 can cause herpes sores in either the oral or genital area. Confusing, isn't it? Now you might ask, how does one get infected with HSV? The virus is highly contagious and can be passed on through direct contact with an infected person. This could be through kissing, sexual contact, or even just sharing a drink. It's crafty and it's sneaky. So what are the symptoms of HSV? They can range from mild to severe. The first outbreak is usually the worst and may include fever, body aches, swollen lymph nodes, and of course sores. The sores start as tiny red spots before developing into blisters. After a while they burst, leaving painful ulcers that eventually crust over and heal. But here's the kicker. Once you have the HSV, it sticks around. The virus lies dormant in your nerve cells and can reactivate at any time, leading to recurrent outbreaks. Stress, illness, or even sun exposure can trigger a new round of symptoms. So what about the cure for HSV? Well, there's some good news and bad news. The bad news is there's no known cure for HSV. Once infected, the virus stays in your body for life. But don't despair just yet. The good news is there are antiviral medications that can help manage outbreaks and reduce the risk of transmission to others. These medications can speed up the healing of sores and decrease the severity and frequency of symptoms. To recap, HSV is a contagious virus that causes cold sores and genital herpes. It's passed on through direct contact with an infected person and results in painful sores. While there is no cure for HSV, antiviral medications can help manage the symptoms and reduce the risk of transmission. Remember, it's always important to consult with a healthcare professional if you think you might have HSV. They can provide accurate diagnosis and appropriate treatment options, so stay informed and stay healthy. Knowledge is power when it comes to HSV. It's a sneaky virus, but with the right information, you can take steps to manage it effectively.